Thank you, George, for your mentorship in the process. I've very much appreciated it. So today I'm glad to be here and feeling a bit light on my feet because it's the first time in 2 months from being in Cleveland that I haven't worn a pair of clunky boots when I walked in a building. We're digging ourselves out. Many of us certainly had to do that to arrive here. So first I'd like to thank the rest of the Planning Committee for this workshop and the planning process. The committee included roundtable members George Isham, Debbie Chang, Mary Lou Gakey, Peggy Honoree, Jeff Levy, Jose Montero, Andy Weber, as well as Jim Hester and Glenn Mays. A list of Planning Committee members and bios are included in your meeting materials. As many of you are aware, the IOM covered the subject of funding for governmental public health, which was near and dear to my heart, most recently in the report for the public's health, investing in a healthier future. As George mentioned, the workshop will build on this theme by focusing on other aspects of funding for population health improvement. Today we'll be covering 3 particular topics. The first will be innovative healthcare system investments in population health improvement, working in coalition with community partners to optimize and measure community benefit. Certainly, CVS Caremark's decision to stop selling tobacco products is a clear demonstration of the power that business can exert on population health. Next, we'll discuss place-based community development and population health work to increase economic opportunity, promote health equity, and reduce disparities. We'll also hear about impact investing that pay for success financing and population health by supporting programs that, for example, might work to reduce recidivism and create dividends from cost savings by preventing incarcerations. To frame these issues, the Planning Committee has identified a dynamic group of experts who have graciously agreed to share their experiences on these critical topics with us today. We'll then hear from some of our Planning Committee members about the implications of this work on the different sectors of the population health practice. Your participation as members of the audience and those participating over the internet will be essential. I'd like to take this opportunity to thank Carol Spicer, Alina Baciu, Andrew Limaris, Colin Fink, and all the other staff at IOM for their expeditious planning of our 5th workshop in just a few short weeks. It was a Herculean effort, and please join me in recognizing them for that accomplishment. It's fitting that an overview of the resources for population health improvement will be provided by our keynote speaker, David Kindig, co-chair of the Roundtable on Population Health Improvement with George, Professor Emeritus of Population Health Sciences and Emeritus Vice Chancellor for Health Sciences at the University of Wisconsin-Madison School of Medicine. Please join me in welcoming Dr. Kindig.